What are C-SNP and D-SNP plans? Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance, and this is the CB Health Insurance YouTube channel. In today's video, we're going to answer what the heck are these C-SNP and D-SNP plans. First and foremost, if you are new to our channel and enjoy this video, don't forget to give us a thumbs up, tell your family and friends, and be sure to subscribe. We release new videos on Medicare topics every 2 weeks. So now on to today's video. What are C-SNP and D-SNP plans? C-SNP actually stands for Chronic Special Needs Plans, and D-SNP stands for Dual Eligible Special Need Plans. What is dual eligible? You're eligible for Medicare and Medicaid, so you get both, Medicare and Medicaid. Now, let's first talk about C-SNP. Easy for me to say, right? You can say that 5 times fast. These are Medicare Advantage plans. Medicare Advantage with prescription drug coverage, MAPDs, also known as Medicare Part C. And C-SNPs are specifically for people that have been diagnosed with specific chronic conditions. What are these chronic conditions? Well, there's 3 that are pretty much universal. One is diabetes. If you either have type 1 or type 2 diabetes, this is not pre-diabetes, but if you have been diagnosed with diabetes, that's one of the chronic conditions. Number 2 is cardiovascular disease, and number 3 is heart failure. Now, some states do have other. It does vary by state, but these are generally the 3 main ones that you will see. Some states might have end-stage liver failure or disease or kidney failure, excuse me, but for the most part, and at least in the state of Illinois, this is what I've seen. Now, who is eligible for the C-SNP plan? Well, 1, you have to be enrolled in Medicare A and B. 2, you have to be diagnosed with this condition. And 3, your doctor has to verify that you have the condition. You can't just say, yeah, I have that, and get into the plan. Because these plans are designed to help you maintain and keep in good health with that condition. So they really have great benefits for those people that have been diagnosed with that condition. Now, when can you enroll? Here's the interesting thing about C-SNPs. You have a one-time per lifetime per condition SEP. What is a SEP? A special enrollment period, when you can enroll any time of the year, all year round, from January through December. Wow, why is that important? Well, most people that want to enroll in a Medicare Advantage plan, just a standard regular old Medicare Advantage plan, they have to do so during the annual open enrollment in the fall, October 15th through December 7th. But if you are diagnosed with a condition, you can enroll any time of the year. Now, there's no timeline or limit as to how soon after you're diagnosed. So for example, if you were diagnosed 20 years ago and you have diabetes and you got it when you were 45 and now you're 65 and you are 75 and there's a new chronic C-SNP plan available in your state, you can use your one-time per condition per lifetime SEP and enroll. So if you enroll in June or apply for the plan in June, it will be effective July 1st. Of course, they have to verify with your doctor, and most carriers will take up to 2 months to contact the doctor and verify that you've been diagnosed with this condition, and then you're approved. So once you use that SEP, you can never use it again, but it's per condition. So if later you get heart failure, you can use that as a SEP. So that's what a C-SNP plan is. It's a chronic special needs plan, and it gives you an opportunity to kind of enroll all year round, one time per lifetime. What about D-SNP? D-SNP, remember, stands for dual eligible. So that means you qualify for Medicare and Medicaid. And so, and it's full Medicaid in most states. It does not include LIS. What is LIS? LIS is low income subsidy. Somebody might be on low income subsidy and qualify for benefits under LIS. That doesn't mean they qualify for Medicaid. However, if you're on Medicaid, you will qualify for LIS. So LIS limits are a little bit higher than Medicaid limits, but you do have to be eligible for Medicaid to get a dual eligible plan. Now, these plans have been around since 2006. when they implemented the Part D drug coverage as well as Part C, both D-SNP and C-SNP plans, and it was part of the 2003 Medicare Prescription Drug Improvement and Modernization Act. That's a mouthful. Now, what's interesting is even though they passed this law a long time ago, or this act a long time ago, in the state of Illinois where I'm at, we did not have, or we don't currently have, D-SNP plans. Why is this? Well, our state passed a separate law that says we will be making available an MMAI plan. What is MM? It's Medicare Medicaid alignment plans. I don't know, there's an I in there and I forgot what it stands for. These plans for 2026 are going away. And guess what? Anybody in the state of Illinois that is dual eligible will now have the opportunity to enroll in a D-SNP plan. And MMAI is going away. Now, there's going to be 4 carriers in the state of Illinois selling D-SNPs in 2026, enrolling people in D-SNP plans. One of them is Aetna, Humana, Meridian, and Molina. Okay, note I didn't say Blue Cross Blue Shield of Illinois. Blue Cross has decided not to offer D-SNP plans, and they do currently offer MMAI plans. So what's going to happen to those plans? Well, the insurance carrier is going to have to notify everybody during the annual open enrollment period in the fall saying, hey, these plans are going away and you have to pick a new plan. So I'm sure those notices will come out by October, on or before the start of the open enrollment. They're going to have to notify you. So these plans, what will they look like for 2026? Because they're new to the state of Illinois. What will the D-SNP plans look like? We don't know. We have to wait till the annual open enrollment, right? And so we will know by October 1st is when they release this information. You can go to Medicare.gov and start looking at the plans. It should be uploaded. You cannot enroll in a plan until October 15th, which is the start of the annual open enrollment, all the way till December 7th for the following year. And the only thing I know is it can be HMO or PPO, similar to a Medicare Advantage plan, but you will have to qualify for both Medicare and Medicaid. If you lose that eligibility, if you lose the ability to be Medicaid eligible, something happens, then you will have a SEP because you will be disenrolled from the dual eligible plan. You'll get to buy an individual plan. So what are C-SNP and D-SNP plans? Now you know. We hope you enjoyed this video. Until next time, this is Kathy Bukowski, the owner of CB Health Insurance. Thanks for watching.